Woman should have a general check by her gynecologist, and you stress over 21, as long as she's over 21 years old, she should have a general check by her gynecologist at least once per year. And what should that entail? That should entail general exam, but it should entail specifically a breast exam. Okay, a breast exam. It should entail a pelvic exam. Okay, a lot of women who come to the practice don't like something that we call a speculum to look at the cervix, but it is very necessary. In addition, digital vaginal exam. A lot of women obviously don't like, a gynecologist putting fingers into the vagina, but this is very important. The woman should also have a pelvic ultrasound. Okay, that is where we look at the womb, we look at the endometrium or the skin inside of the cavity of the womb to make sure that there's no sign of womb cancer, there's no sign of anything going wrong in that department. We look at the ovaries to make sure that the ovaries are okay, right? And finally, she should have a pap smear. Okay, now what I've seen here in Antigua is that too many women, okay, are not doing their annual pap smears. Okay, at least women in their 20s. Once you get over to your 30s and so on, the frequency of the pap smear may be reduced. You could probably do your pap smear every 2 years, 2 to 3 years. But when you're in your 20s, let's say between 21 and 29, a lady needs to do an annual pap smear as part of her general gynecological check.
Why do you stress 21 to 29?
Very good question. I stress that because most of what we look for on a pap smear, first of all, are precancerous changes. In other words, changes on your cervix that may be leading up to cancer, to cervical cancer. Now, cervical cancer doesn't just happen overnight. If a lady is 45 and she's diagnosed with cervical cancer, that process to get her to cervical cancer did not happen overnight. It happened over a long period of years, okay? Normally, the woman gets infected with a virus that is called the human papilloma virus, or HPV. And that virus begins to make small changes year after year on her cervix, on the skin, on the epithelium of her cervix. Now, what the pap smear does is that it picks up these changes before they get to cancer, to invasive cancer. So if a woman is doing her pap smears, particularly in her 20s, the reason why we stress doing it every year is because typically she's going to get the virus when she's a teen. She's going to get the virus when she's 15 or 16 or 17. And so that stage, 21 to 30, is very important because we need to look carefully at that cervix during those years, because those are the years that the changes typically begin. If the woman's pap smears have come back normal by the time she's 30, we can say, well, hey, she's no longer in this danger zone for age. So, and all of her pap smears have been negative so far. So we can now reduce the frequency of the pap smears, and we can do them every 2 to 3 years.
Do you reference teens because of the assumption in that comment that teens are highly sexually active?
Well, of course, teens typically they have just gone into their secondary sexual development, and as a result of that, their hormones are highly elevated, and they tend to be not necessarily more sexually active, but they tend to be a bit more promiscuous and to engage more in unprotected sexual activity, and that is the issue. As a teen, teens are going to tend to engage more in unprotected sexual activity. And as a result of that, they are more likely, teens and persons, let's say below 25, they are more likely during that period to contract this HPV virus.